So, hi, my name is Chase. I will be your nursing student today. We will be doing a head-to-toe evaluation on you. Is that okay with you?
Yeah, that's okay.
Okay. So, I'm going to get some basic information from you to start with. I'm going to draw a privacy curtain, make sure that you're feeling all right. So, can you give me your name and your date of birth?
My name is Cameron Mashburn, and my date of birth is 12/3/2003.
Okay. Do you know what you're here for today?
Head-to-toe assessment.
All right. Do you know where you are?
Yes, in the tech building.
Do you know who the President of the United States is?
Right now, it's Joe Biden.
Okay, cool. All right. So we're going to start off with some basic vitals. Since we are not in the lab, we're going to simulate vitals. I would take your pulse, your blood pressure, O2 reading, temperature, and your respiration rate, as well as I would ask you how are you feeling on a pain scale from 0 to 10.
I don't feel any pain at all.
Okay, so no pain. We would then take your height and weight, calculate your BMI, document that. So we'd start with head assessment. I don't have any gloves on me, so I would put on gloves. Go through, inspect your hairline for any lesions, any infestations, bumps, anything like that. Feel around on your head for any abnormalities, indentations, any type of masses. So then we move on to checking basic facial nerves. So I'm going to ask you to close your eyes really tight and open them. Okay, give me a smile, give me a frown, and puff your cheeks out for me. Okay, looks good. All right, then I would put gloves on, I'd palpate your head. We'd check skin for any lesions. Same thing with like the top of your head, any abnormalities. We'd check your beard for any infestations, any abnormalities. From there, we're gonna go into temporal arteries. So I'm gonna feel your pulse here. Okay, so you got a nice bounding pulse there. Nice bounding pulse there. All right, and then I'm gonna have you clench your jaw real quick. All right, and there. Yep. All right, I'm gonna gently push on areas of your face. Let me know if you feel any pain.
Okay.
So I'm gonna gently press here. Any pain?
Nope.
All right, how about here?
Nope.
All right, sounds good. All right, so now we're gonna go into an eye exam.
Okay.
I'm gonna check, make sure that you don't have any weird problems with your eyes, any vision issues.
I wear contacts, but other than that, no.
Okay. So visual inspection's fine. I'm gonna gently pull down here. Looks good there. Looks good here. All right. Now I'm going to do a check here. We're gonna do something called a nystagmus test. So I'm gonna hold my pen light out and follow it just with your eyes. Don't turn your head. So follow my pen. Okay, no problems there. All right, I'm gonna turn the light on and I'm gonna shine it in your eyes.
Okay.
That'd be bright. Good. Okay. Looks good. All right, now I'm gonna check for accommodation. So I'm gonna hold my pen out here. I'm gonna slowly bring it towards your face.
Okay.
Just concentrate on the top of the pen here. All right, looks good. All right. Next, we're gonna check out your nose and your ears.
Okay.
So I'm gonna take my pen light. I'm gonna use the low intensity so I don't blind you. I don't see anything in your nose. That's a problem. Check your ears.
Might be a little waxy.
Oh, good. Nice earrings, by the way.
Thanks.
All right. So, since we don't have anything to do a smelling test with, I'm going to simulate that we're doing a smelling test. So, I would provide some sort of scented oil and see if you're able to identify the scent of it to, do your olfactory test. So next, we would go to moving on to assess your mouth. So I put gloves on. So we're gonna have you I'm gonna have you stick your tongue out for me and move it side to side.
Okay, so.
Alright, sounds good. Alright, and then I'm gonna put my hand right here.
Mhm.
Can you try to open your jaw for me? Alright. Sounds good. Alright, open your mouth for me. Open real wide and say ah. Alright, sounds good. I'm not gonna subject you to a gag reflex test just because, you know, I don't want you throwing up in the tech building.
Yeah.
Because you never know. Alright. Have you had any trouble swallowing?
Nope.
So no problems, any hoarse voice when you're talking, anything like that? Alright.
No issues.
So I'm gonna go ahead and place my hands here on your shoulder.
Okay.
Go ahead and shrug. Alright. And then are you able to move your head side to side and up and down? Alright, sounds good. Alright, so I want you to turn your head sideways at that 45-degree angle away from me. So, alright, don't see anything there. Alright, we're gonna do a neck check here.
There you go.
So everything seems normal here. Alright, now I'm gonna do a carotid artery check.
Okay.
Same thing I did with your temporal pulse. Good, nice bounding pulse here. Nice bounding pulse there. Alright. And I'm gonna pull my stethoscope out and I'm gonna listen. So what I'm gonna have you do is I'm gonna have you take a deep breath in
Okay.
and hold it while I listen.
Mhm.
And then we'll switch to the other side and do the same thing.
Okay.
Alright, breathe in for me. Okay. Breathe in. Alright. So, nothing weird blocking your arteries. Alright, so I'm going to do a check on your upper extremities now.
Okay.
So, we would also do this with a chest inspection, but I'm not going to have you remove your shirt.
Okay.
So we're just, I check for skin integrity, check for any lesions, bumps, masses, the normal checking of skin.
Yeah.
As well as we could do your back as well at that time when you remove your shirt. Next we're gonna do range of motion on your arms.
Okay.
So have you just move your arm back and forth. Anything feel stiff, hurting?
Nope.
Anything like that?
Nope.
All right, sounds good. All right, I'm gonna pull your sleeve up here.
All right.
I'll check your brachial pulse here, or brachial artery here. Nice bounding. We're going to do the same thing here with your radial artery. Good on that side. And then we're going to do a capillary refill. So I'm going to press gently on your finger and see how long it takes for them to turn back pink. All right, good here. Do the same thing on this side.
All right.
All right, let's start here. Nice bounding pulse here. Nice bounding pulse here. Let's do range of motion. Nothing feels stiff, hurting, anything like that? Alright. Capillary refill. Alright, looks good there. Alright, we're also going to do skin turgor, so I'm going to gently pinch your skin and let it go. Alright, perfectly fine. So next we're going to do a strength test, alright?
Okay.
So I'm going to cross my fingers like this. I want you to squeeze my fingers.
Mhm.
Easily hard. Alright, looks good. Alright, so I'm going to have you lift your arms and push against me. So I'm going to hold your wrist. So push.
I'll be with the chair.
Alright, and then I'm going to push against you. You resist my pressure, okay? Okay, good. Alright, so I'm going to have you stand up. We're going to do a drift test.
Okay.
So I want you to close your eyes, put both your arms out in front of you, and then just hold it there for about 10 seconds, okay? Alright.
All good?
Yep, no arm drift. Pretty good there. I'm gonna assess your heart and your lung sounds now.
You
So
wanna sit down?
I'll just have you stand up for it.
Okay.
That way it'll be easier.
Sounds good.
So we'll do heart sounds first.
Okay.
lung sounds. So I'm gonna place my stethoscope on different parts of your chest, and when I do that, just breathe in and out for me.
Okay.
All right, so breathe in. All right, I'm gonna do the same thing on your back. All right.
All right.
So in. Out. Breathe in. Out. Breathe in. All right.
Alrighty, all good?
Yep, so everything sounds good, no abnormal sounds. So next we would be doing a series of other checks. So you do one of your abdomen, but since, you know, I'm not gonna have you remove your shirt or anything, so we're gonna simulate it. So you would first check, you know, like you'd look at it, you know, see if there's any, you know, abnormalities, lesions, any injuries, any weird like swelling or indentations, and then I would take my stethoscope and I'd listen to the different areas. So I'd start in your left, your right lower quadrant, and I'd move in a clockwise manner through the different quadrants, listening for bout sounds for a minute each. From there, we would move on to palpation. So I would gently press and see if you have any, you know, masses or any hard spots in your abdominal organs. Check for, you know, masses, blockages, any type of that.
Mm-hmm.
So we'd start with a light palpation and go around, and then we'd start with a deep palpation, checking for anything, making sure everything's soft and squishy.
Mm-hmm.
And then from there we'd move on to your lower extremities. So I'm not gonna have you take your pants or your shoes off as much as, you know, you would in a normal clinical setting.
Yeah.
But, you know, we do the same thing with your legs. You know, we check, make sure you don't have any skin issues, any, you know, rashes, you know, injuries, anything like that.
Mm-hmm.
We would check pulses at your popliteal, which is behind your knee.
Mm-hmm.
And then we would also check your pedal pulses, which is at your feet. So we would also take your shoes off, inspect your feet,
Mm-hmm.
You know, for any signs of, you know, damage, infections, fungus infections, because athlete's feet and stuff like that's really prominent with a lot of people.
Mm-hmm.
You know, check for anything like that. We'd also do capillary refill tests on your toes to ensure that, you know, like you're getting adequate blood flow. That's why we check all the arteries and pulses, make sure that you have adequate blood flow throughout like your entire body.
Mm-hmm.
And then after that, we would move on to your back and do the same thing as we did for your chest. We'd check for any skin irritation, any problems, any indentations, masses. We feel around for everything and, you know, make sure that everything's all good. Other than that, do you have any other questions for me?
Nope, I do not.
All right, then our assessment is complete.
Alright, sounds good.
Sounds good.